We use Florence to remotely monitor the health status of heart failure patients. The idea behind applying Florence was that we can risk stratify those patients that are on our waiting list and have deteriorating symptoms, and then to bring them in earlier, which means they don't have to go through A&E, they don't have to go through sitting on a ward waiting for it to be scheduled. At the time, there were several hundred people waiting. Now, we are less than 100. The idea of the project was to try to impact the clinical team as little as possible to get as much buy-in from them as possible. We took data from our pre-intervention group, then we measured that against the outcomes from the project group of patients. We compared the outcomes in a lot of different ways: length of stays, readmission rates, A&E access, costs to the health economy. Yes. And in almost every metric, there was an improvement between the pre-project group and the post-project group within the project. If a patient responded to say that they were red, amber, or worse, then we would contact them and track those symptoms, and then report to the most appropriate pathway, stratify those patients that did need to be seen by a clinician. The great thing about Florence is the fact that text messages are a technology that every age cohort will be familiar with. Patients were very happy with the technology which they were using. We saw that they could access pathways when they needed them.
I read the evaluation. You had a 44% risk reduction of attendance in A&E and a 67% risk reduction in emergency readmission. The project could have released savings around £344,000. We've been doing some work in America. An amazing uptake and completion of the protocols, like 97%.
Most patients saw it for what it was, as a brilliant tool to look after them. The folk at Generated Health and within Florence, they have been incredibly helpful. They've provided like a flow diagram, which makes it very easy for the clinician. See that the lessons from Smart With Your Heart indicate that there's a saving for the health economy. Kind of hit a very sweet spot using the technology that's simplistic, that patients feel cared for,